This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, March 24th. This is Africa 54. The spread of the coronavirus continues to be fast and deadly. Confirmed cases of COVID-19 now surpasses 377,000 worldwide across 194 nations and territories, with more than 16,000 deaths connected to the virus, according to Tuesday's Reuters total. Nearly 40,000 cases and over 1,800 deaths were reported in just the past day. In Africa, Nigeria's Center for Disease Control confirmed its first case of COVID-19 in a tweet on Monday. The patient was a 67-year-old man who returned to the country following a medical procedure in Britain. In Egypt, the health ministry says 2 senior Egyptian military officials have died from the coronavirus in the last 2 days. Sudanese officials are imposing a nationwide curfew Tuesday at 8 p.m. local time to help halt the spread of COVID-19, according to state television. Tunisian President Kais Saied is ordering the army to deploy in the streets to force people to adhere to a coronavirus lockdown. The country has 89 confirmed cases of COVID-19. South African President Cyril Ramaphosa says he is imposing a 21-day nationwide lockdown to begin at midnight local time on Thursday in an attempt to slow the spread of the coronavirus. The country's confirmed cases of the virus has now soared past 400. As South Africa's government tries to stop the spread of the coronavirus, houses of worship have been particularly impacted by guidelines to limit gatherings to fewer than 100 people. But they are finding creative ways to keep the faith. VOA's Anita Powell reports from Johannesburg.
Church, usually a big affair in majority Christian South Africa, is looking a little different these days as the nation tries to stop the spread of the novel coronavirus. But they are finding creative ways to keep the fires of faith burning. Many South African congregations started live streaming this past weekend, and mosques in the Rainbow Nation have also closed to large crowds, asking the faithful to instead meet in small groups. Worshippers accustomed to praying shoulder to shoulder have spaced themselves out. But as more churches go online, the band must play on. Organist Emmanuel Agwebu performed from near-empty church in southern Johannesburg on Sunday. Usually, 400 people come. This Sunday, it was 58 faithful, and the choir, too, was thinned out. He says he took precautions.
I made sure to isolate myself from the congregation as much as possible. So the organ is situated in a very different place entirely, in a different cubicle. So we don't really have to worry so much about having contact with the other people in the church.
The head of the Al Jamaa political party, which advocates for the rights of Muslim South Africans, said the Muslim community should heed the government's guidelines.
We hope that you will have the wisdom of Solomon and give more leadership to the country. Allah knows best.
But Agwebu says in times like this, music matters.
This pandemic is going to last just for a few months, but music is going to stay. So the decisions we make now might affect the outcome at the end of the pandemic. We hope it's going to go away soon, and we hope to continue to pray as much as we can for people. And music is my way of reaching out to people.
For believers, this crisis presents more than a physical challenge. It's a unique test of faith. But this, they say, is a test they are ready for. Anita Powell, VOA News, Johannesburg.
Like a growing number of countries worldwide, France is under lockdown to slow the spread of the deadly coronavirus. Lisa Brandt examines how changes, large and small, are affecting Parisians.
Life under lockdown is unsettling. For some people, it's lonely and scary, but it's also a kind of revelation. This city I've lived in for 20 years has slowed to a halt. The Louvre and Tuileries without tourists, Les Halles without shoppers, the Seine River with no strollers, Place de la République with no protesters. Some things haven't changed. Food markets of all kinds are open. for now. And here in France, a fresh baguette, of course, is considered as necessary as medicine. As a journalist, I can go out and cover stories. I'm splitting my time between my office in Paris and my partner's home in the suburbs. But everyone leaving home must now carry a signed paper that meets very narrow criteria for going out, like food shopping or exercise. Violators risk being fined more than $140. But for those of us lucky enough to still be healthy, slowing down, staying home, and appreciating the life we often race through may not be such a bad idea. Lisa Bryant for VOA News, Paris.
In the southern U.S. state of Florida, residents aren't strangers to natural disasters, namely hurricanes and floods. But the coronavirus pandemic is affecting residents more than they could have imagined. Lilia Anisimova has the story, narrated here by Anna Rice.
With the number of confirmed coronavirus cases well into the hundreds in Florida, residents are rushing to stores to buy food and stock up on necessities.
I have a family and I don't want to wait until, everything is empty and I don't have enough. I think it's my responsibility with my family.
Usually they order especially baby formulas, baby wipes, water.
If we end up being quarantined like China, then you can't leave your house, so you got to keep stuff in supplies.
The coronavirus pandemic has especially disrupted Florida's tourism industry that traditionally booms during spring break. Miami authorities have canceled the annual Ultra Music Festival scheduled for the end of March. Florida has also canceled the Miami Open tennis tournament. Carlos Jimenez, mayor of Miami-Dade County, has ordered clubs, bars, and schools to close and announced special provisions for the elderly.
All community centers that serve seniors will close in the afternoon. They are the most vulnerable to the COVID-19 virus, our senior citizens. They will be supplied with enough meals to get them through the week. Starting next week, the county will be delivering meals to those seniors at their homes until further notice.
This pandemic is personal for Miami Mayor Francis Suarez, who tested positive for coronavirus. He keeps a video diary in social media networks where he updates people daily on his well-being and physical state.
The fourth day, today I feel very good. I took 2 temperature readings this morning, and that was at 98. If mild to almost no symptoms right now, so I'm very fortunate that I seem to be, for the moment, in that 80% category who's experiencing mild to no symptoms.
By mid-March, Florida had 4 deaths from coronavirus, as hundreds of people are still waiting to be tested. For Lilia Anisimova in Miami, Florida, Anna Rice, VOA News.
As the global cases of COVID-19 surge, U.S. President Donald Trump says he's open to helping North Korea, Iran, and other countries who need assistance. But there is nothing in the hotly contested $1 trillion plus stimulus package now being debated in Congress that is being allocated for international aid. VOA White House correspondent Patsy Widakuswara has more.
Hundreds of thousands of COVID-19 cases have now been found in at least 167 countries. On Sunday, U.S. President Donald Trump said that he is open to providing international aid, but did not provide details.
The Surgeon General is speaking to other countries all the time. They're asking him questions. What do we do? Nobody's ever seen anything like this. They're calling our people all of the time. And yes, I have let it be known that we'll help people, including North Korea, including Iran, and including many other countries. It's very important to do that.
The nearly $8 billion in COVID-19 financial aid passed by Congress in early March allocated more than $1 billion for international activities, including assistance through USAID, the United States Agency for International Development.
And it included $300 million towards USAID for work overseas in support of countries that are vulnerable, particularly low-income countries, particularly in Africa, where the preparedness capacity to detect, to surveil, to do contact tracing, to isolate, those capacities need to be strengthened.
But there is no foreign aid allocated in the more than $1 trillion economic stimulus package.
So, no, not in the stimulus bill, but we are very much, we give away billions of dollars for, as an example, AIDS in Africa. We're still fighting that battle.
Meanwhile, hoping to diffuse criticism that it allowed the disease to spread early on, Chinese companies are selling and donating test kits, health equipment, and medicine to some European countries and all 54 countries in Africa.
China definitely sees a major opportunity with the coronavirus to try to build goodwill. It has this opportunity in part because the United States and Europe have been so inactive. This is a story not just of Chinese activity, which should be concerning, but also of American inactivity and failure of leadership, which I would argue is even more concerning.
On Monday, the World Health Organization said that the pandemic is accelerating. The WHO is asking leaders of the G20 to ramp up production of personal protective equipment for health workers. Patsy Widakuswara, VOA News at the White House.
Some of the world's busiest streets now look like scenes from post-apocalyptic movies. The COVID-19 pandemic has most people staying at home, while authorities take advantage to wage war on the coronavirus, one block at a time. VOA's Arasha Rabasadi explains.
In Bangkok, the streets are deserted except for military trucks and workers in hazmat suits. This new normal in the Thai capital and other major world cities comes as social distancing keeps most people at home and clears the way for crews to disinfect the streets where known cases once thrived.
Of the group that was recently discovered beginning on March 14th, 57 cases alone were connected to a nightclub and a boxing arena. They included organizers, hosts, and an audience filled with family members and close contacts.
Infections in Thailand jumped to more than 700 on Monday, according to press reports, with one death. In Kenya's capital, reduced street traffic gives health workers the opportunity to wage war on many pathogens with disinfectants.
This sanitation exercise will be of great help. We are targeting all kinds of germs, not just corona. We are using chlorine, which we'll also use to effectively kill germs.
Workers from the health ministry sanitized public transportation in Nairobi and installed sinks for convenient hand washing. Nineveh, an Iraqi city on the outskirts of Mosul, had 0 confirmed cases last week, but street sanitizing continues. Iraq has at least 230 reported cases and 20 people have died. In Syria, the White Helmets, a group known for search and rescue operations, now has a new mission.
The team is tasked with sanitizing the public areas, mosques, schools, churches and halls people frequent. We also offer advice to help people face the virus.
The war-torn country confirmed its first case of coronavirus Sunday. India, home to more than 1.3 billion people, reported 415 cases and 7 deaths, but health experts warn a spike in coronavirus cases may overwhelm public health infrastructure. Arash Arabasadi, VOA News, Washington.
As crowds flocked to view the cherry blossoms here in Washington, D.C. over the weekend, authorities issued a warning that it's becoming increasingly difficult to maintain social distancing amid the coronavirus outbreak. This comes as more than 1.5 billion people worldwide were asked or ordered to stay home. VOA's Maria Madiallo reports.
As crowds increased at Washington's tidal basin, where visitors can see the cherry blossoms, the National Park Service urged everyone to reconsider a visit. In a Twitter message, authorities say they will be implementing traffic control measures to discourage excessive visitation. On Sunday, President Donald Trump, referring to the coronavirus, said America was at war.
It's never been anything like this, and it's vicious.
But some visitors were undeterred.
Yeah, you don't get the coronavirus from cherry blossoms. You have to stay safe, follow the rules, don't do anything that looks risky.
I figure we're keeping safe distance. I'm not going to be here long. There's a breeze right here in the water, and we're not touching anything.
And as governmental agencies worldwide are encouraging and sometimes ordering their citizens to stay home, one visitor sees things differently.
The idea of being outside, adding that healthiness to our bodies, our spirits, our minds back into our day.
She says she's aware of the increased risk, but with her 3 sons, she took some basic precautions.
A little bit more awareness, especially of elderly people. I know I felt that. I wanted my kids to hang back, and so folks who are in those risk categories to have the space they need to also appreciate.
Most cherry blossom-related events have been canceled and certain subway stations closed to deter visitors. Mariama Diallo, VOA News, Washington.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the conversation on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Still to come, it's World Tuberculosis Day this Tuesday, as health experts warn that Nigeria might not meet the United Nations 2030 tuberculosis eradication target. Thousands of U.S. schools are closing this week as officials attempt to contain the COVID-19 outbreak. The action is presenting new challenges for families who rely on the school's free meals and who don't have the technology needed for their children to study at home. VOA's Christina Smith reports on how one school district is handling the challenges.
Schools have closed across the U.S. to prevent the spread of the new coronavirus, leaving thousands of students at home. As in other school districts, some families in Montgomery County, Maryland, count on the school's free meals for their children. Others don't have the technology their kids need to do their online assignments at home. So the Montgomery County Public Schools District is delivering printed materials to them.
We have all the materials ready and we make copies available. Most of the elementary students and some 6th grade students receive materials, but we understand that not all receive materials.
Most educational institutions offer breakfast and lunch to low-income families. When the district first closed in the wake of the coronavirus outbreak, the school system served only lunch, but it added all 3 meals since then. So far, they have served 18,000 meals.
They're increasing the number of meals. Most are served to the Hispanic community. Many do not have access to vehicles. We are driving them in cars and bringing the children on several trips.
Sandra Martinez is a mother of 2 children, a 13-year-old boy and a 5-year-old girl.
This is the first day I come to pick up their homework and their meals. The school always provides food.
Melissa Rivera, head of communications for Montgomery County Public Schools, says that the most important thing is the safety and well-being of the families, and if possible, to maintain a routine similar to the one at school.
Try to keep the same school schedule, and that they also establish a schedule at home for reading, a schedule for reviewing homework, to do an activity, some entertainment, another for perhaps doing some physical activity.
Some public schools in the country only plan to close for the next 2 weeks, Others are considered shutting their doors for the rest of the year. Cristina Caicedo-Smith, VOA News, Gaithersburg, Maryland.
U.S. Secretary of State Mike Pompeo made an announced visit to Kabul on Monday to meet with Afghanistan's rival leaders as he sought to end the political crisis and salvage the peace process with the Afghan Taliban. But after the visit, Pompeo blasted those leaders, saying they were unable to agree on an inclusive government and announcing a $1 billion cut in U.S. assistance to Afghanistan for this year. VOA diplomatic correspondent Cindy Sain has the story.
Secretary of State Mike Pompeo traveled to violence-stricken Afghanistan during the middle of the global coronavirus pandemic to meet in person with both Afghan President Ashraf Ghani and his rival Abdullah Abdullah. Both Ghani and Abdullah declared themselves president of the country after a contentious election, and the dispute threatens to derail a deal signed between the U.S. and the Taliban last month. In a written statement hours after the visit, Pompeo strongly rebuked Ghani and Abdullah by name, saying their failure has harmed U.S.-Afghan relations and sadly dishonors those Afghan, American, and coalition partners who have sacrificed their lives and treasure in the struggle to build a new future for this country. Experts say Pompeo's visit, under the circumstances, showed just how high the stakes were.
I think that the idea here was to signal to Kabul and to Afghanistan on the whole just how committed the U.S. is to helping Afghanistan get through a very difficult political crisis that has stood in the way of launching peace talks.
Last month's historic peace deal in Doha has been followed by weeks of disputes between the Taliban and the Afghan government. Cindy Sain, VOA News.
March 24th marks World Tuberculosis Day by the World Health Organization. The day is targeted to raise public awareness about the devastating consequences of TB and step up efforts to end the global TB epidemic. According to the WHO, tuberculosis remains the world's deadliest infection disease killer. Each day, over 4,000 people lose their lives to TB and close to 30,000 people fall ill with a preventable and curable disease.
So the WHO test is available for countries in Africa. At the beginning of the outbreak, only 2 countries were prepared. There was Senegal and I think South Africa. But 38 countries have received testing kits. And then the Chinese billionaire, of course, is sending 1,000 testing kits each to all of the countries in Africa. So there is some testing capacity. The idea here is to be able to ramp up that capacity because when we first responded to Ebola, it was taking us between 9 to 12 days to get back test results. And that affects the ability to respond because once you test people, then you isolate the sick from the well so that the sick do not infect the well. So I've been hearing all of this about social distancing. That is good, and we should do that. Back during Ebola, we called the entire thing behavior change. So it includes the hand washing, it includes the social distancing, it includes the don't touch the fluids of sick people. All of that together was called behavior change. But behavior change, social distancing, all of that works if you can isolate those who are sick from the population as well.
8 countries account for 2/3 of the total worldwide cases of TB, including India, China, Nigeria, South Africa, and Indonesia, according to the WHO. About 58 million lives have been saved since the year 2000, but experts say more remains to be done to prevent and treat the disease. The theme for this year's World TB Day is It's Time. The WHO aims to diagnose and treat 40 million people with tuberculosis by the year 2022. Health experts say Nigeria isn't likely to meet the United Nations 2030 tuberculosis eradication target, as the nation still accounts for the highest fatality rate from the disease in Africa. Officials say they're trying to address major factors like inadequate awareness and funding by offering free screening and treatment. Timothy Obiezu reports from Abuja.
In 2015,
Funke Dosumu separated herself from her husband and children after learning that she had tuberculosis. She had been sick and coughing for weeks.
I couldn't eat. All I could do was cough through the night, sweat. I can't sleep. I can't take my bath myself. I lost my kg down to 42 kg.
She remained isolated and received treatment for a year. She also lost her job.
I lost my job during the time of fighting this tuberculosis. I didn't get my job back, but I as a passionate TB survivor, I didn't relent. I'm still speaking about it because I know a lot of people are out there that lost their jobs the same way I did. And because of this, those that even want to advocate for TB will not be able to come out because of the discrimination attached to tuberculosis.
The World Health Organization says Nigeria has the highest TB fatality rate in Africa and one of the highest worldwide. Officials say part of the problem is inadequate funding along with stigma and lack of awareness.
Not many people know that a cough that had lasted for 2 weeks could be tuberculosis. And so rather than going to the health facilities to be tested, they rather go to buy, we all know, go to medicine vendor who will give paracetamol.
Nigeria health officials say the country needs about $278 million annually to address the problem, but it has only about 8% of what it needs. Nigeria is partnering with various organizations to improve awareness and funding for treatments. Last weekend in Abuja, hundreds of citizens received free screening and drugs during a street rally organized by Nigeria's health ministry and partners like USAID.
So we're currently funding interventions that partner with patent medicine vendors because that's why people most of the time seek care first. We're partnering with community pharmacists, we're working with private care providers, private clinics, and getting them to, first of all, think TB when patients come into their hospitals, but also to be equipped to give them the right type of care.
Although experts say it could take Nigeria far beyond 2030 to meet the TB eradication target, the country is not as far behind as it used to be. Timothy Obiezu for VOA News, Abuja.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.